So this recording is on human development.
And as the cells continue to grow, they change their physical positions, their kind of geographical relationship to one another. And you'll see that represented here as this disc gets transformed into an embryo. Those lines represent sites where cells are migrating in and out. And here's an important stage when the three beginning layers of the embryo, the so-called germ layers, are formed. And I'll come back to that in a few minutes.
Here, this is just to show you that in the beginning, the human embryo is actually a flat, slipper-shaped embryo. It then folds inside like this and front and back, and that's how we become tubular. And we have, you know, like our gastrointestinal and other systems inside.
As development proceeds, there's more growth and movement of cells. It'll begin to form a neural tube. Here it turns and appendages start to bud out. You see the head forming and the eye. And then eventually we get a small embryo. And some months later, of course, this would be born.
So this is the slipper-shaped embryo, the three germ layers. And now it's just showing you how it's going to fold. So they're taking a section here. So look at this, it's a flat embryo here. This is where the neural tube forms. And right here is where you have what's called neural crest cells. And here, if you see, this will fold right up to here. So you can see this is the skin, all of the skin on the outside. This is your gut tube inside. This is where your brain and spinal cord will develop. And on either side, this is what called mesoderm, where your various muscles, bone, dermis of skin and other structures develop. Okay? This again is showing you how the neural tube forms, because you're going to do a lot of neural tube. So this is on the surface of the embryo, where the ectoderm actually kind of goes inside. And notice how it's forming a tube. And this part becomes the brain, the spinal cord. And on either side, can you see these little blocks? These are what are called somites, and they are made of mesoderm, and they will form muscle, mesoderm for muscle. Okay, these folds are which will give rise to something known as neural crest cells, which you'll see later in your PowerPoint slides. So notice how you have muscle or somites on either side of this developing brain and spinal cord. Okay, so now you can see how it's a tubular embryo. So when you look at the nervous system, you divide it into two parts. One is, this is structurally, or what is known as anatomically, meaning where it is placed. You divide it into a central nervous system, which consists of the brain and the spinal cord. So it's in the central axis. So this is brain and spinal cord. And this is the peripheral nervous system, which is from the brain you have cranial nerves, 12 pairs of cranial nerves which come out, and from the spinal cord you have spinal nerves, 31 pairs of spinal nerves which come out. So that forms the peripheral nervous system. Okay, so it's almost like the brain and spinal cord, the central nervous system is the headquarters, and the peripheral is the distribution center. Now functionally, based on what they supply, you divide it into somatic and autonomic nervous system. Somatic is also known as voluntary, because it supplies skeletal muscle, Autonomic is known as involuntary because it supplies smooth muscle, cardiac muscle and glands. These are not under your control. The other thing to remember about the somatic nervous system is one part is supplying muscle, so that part is known as motor. So it goes out to supply muscle. But the somatic nervous system also carries sensations from the skin, joints, muscles and even viscera. So that is known as sensory information. So sensory information goes towards the brain and spinal cord, and motor information goes away from the brain and spinal cord. We'll do that later. So for now, just remember that somatic has both a motor and a sensory component. The autonomic, which is involuntary, just has a motor component because it supplies smooth muscle, cardiac muscle and glands. Okay, this was the functional division. Now where is the somatic housed? It involves all of the central nervous system. So its headquarters are in all of the brain and the spinal cord. And it also involves all of the peripheral nervous system. So it uses all the cranial and the spinal nerves to either send or receive its information. The autonomic nervous system is divided into two parts, sympathetic and parasympathetic. They use only parts of the central nervous system and parts of the peripheral nervous system. So they don't use all of it. Okay, so we'll do that. We'll come to that later. Now let's look at the brain, the central nervous system and the coverings, because it's very important. It's covered by meninges. So you can see here, these are the meninges which cover the central nervous system, all of the brain and the spinal cord. And there are three layers of meninges. The layers are dura mater, and let's see, this is dura mater or mater, arachnoid mater, mater means mother, and pia mater. Dura is the outermost layer, arachnoid is the middle layer, and pia mater is the innermost layer. The pia mater, again, it's very important to be looking at these pictures very carefully. So imagine you take a section up here through the brain, through the skull and the brain, and this picture here is showing you that. So here's the skull. The dura mater has two layers. You can, kind of forget the two layers. It's not all that important. So here it is. This is the dura mater, this gray layer that is shown. There's actually a little space between this dura mater and the skull. And since it's above the dura mater, that space is known as the epidural space, or also known as extra. The word epi means above. So epidural meaning above. Okay. So this epidural space is a potential space present here. Below the dura mater is this cobwebby layer that you see, which is known as the arachnoid mater. Between the dura mater and the arachnoid mater, so let's say this is dura, arachnoid and pia mater. Above the dura mater is this epidural space. Between dura and arachnoid is a space which is called subdural space. Sub meaning below. Between the arachnoid mater and the pia mater is a space which is known as subarachnoid, meaning below arachnoid. And you can see this is this large subarachnoid space that you're seeing here. You see this, which has vessels. They're only showing an artery, but it has veins also. This is the space, the subarachnoid space, which has cerebrospinal fluid. And this fluid bathes the brain and the spinal cord. It kind of acts like a protective shock absorber. Okay, let's now go to the somatic nervous system. So here we have the somatic nervous system. And if you remember, I told you it uses all of the brain and spinal cord. So that is the central nervous system part of it. and then it uses all the cranial and spinal nerves, which is the peripheral nervous system. So it uses all of that to transmit information and receive information. And if you look at that, you can see here from the brain, these are impulses. Any impulse which goes out of the central nervous system to the periphery is known as a motor impulse, or also known as an efferent impulse. I'll be repeating this often, so you can see it from here. So, and traditionally, whenever we draw in anatomy and neuroanatomy specifically, when you use this, that means that's a cell body of a neuron, it's traveling, and when you draw this, that means that's where it's ending. Okay, so if you look at these pictures here, you can see here's where the cell body is beginning in the brain, it's coming down, it ends here in the brain stem, and again another cell body travels out and it goes to skeletal muscle. If you look at the other part, you can see some of these come, this is through cranial nerves, because this is to muscles of the head and neck area. Some other neurons travel all the way down into the spinal cord, they synapse there, and a second set of neurons begin from there and again go to skeletal muscle. So these are these spinal nerves. So this is information which is going out of the central nervous system towards the periphery, and this is known as motor or efferent information. Okay. You also get afferent information from the skin, muscles, bones. That information comes, so imagine you have information from the skin of any part of your limbs or trunk, or skin from the head and neck area. The information goes up into the central nervous system. So it's going upwards towards the central nervous system. We call this kind of information sensory information, and it's also known as afferent. And what kind of sensory information? This is touch, temperature, pain, pressure, joint, muscle sense, and from the viscera, that kind of information is stretch or ischemia. Now, why do we call it somatic nervous system? Somatic means actually the body wall. So somatic is really means the body wall. So somatic means the body wall. So that's why it's going to the outer surface of your body where all the skeletal muscle is, or it's getting information from the skin and the joints and so on. Okay. Now let's look at a typical spinal nerve. So if you look here, I'm going to describe these spinal nerves. I'm going to describe one of them, a typical spinal nerve, and then tell you that cranial nerves don't behave typically, because some cranial nerves may be sensory, some may be motor, some may be mixed. So let's look at a typical spinal nerve, and this is a cross section taken from the spinal cord. And if you look at the spinal cord, there is gray matter which is present in the center of the spinal cord. There's white matter which surrounds it on the outside. Gray matter always has, so gray matter always has the cell body of a neuron. And what do I mean by cell body? So if I draw a typical multipolar neuron, so you know about neurons, right? The different types of neurons. So here's if I'm drawing a multipolar neuron. This is the nucleus with the nucleolus inside, and it always has just one long process which is known as the axon. So this is the axon. These little processes are known as dendrites, and this area here is called the cell body. So traditionally when we're drawing, we can't draw such a big thing like that. So we always represent the cell body with just a dot and the axon with a little line like that. Okay. So let's look here. So here's this gray matter, so where the cell bodies are, and this is the white matter where the processes are. Most of the axons are here. Now each spinal nerve is attached on either side. So because you have pairs of spinal nerves, so it is attached to the spinal cord at a level, and that level is known as the spinal segment. So this is one spinal segment. Okay, so arbitrarily we divide the spinal cord into 31 segments because there are 31 spinal nerves. So here it is attached by two roots. So again, pay attention to everything that is there, every label that is there on any PowerPoint slide. So this is known, because this is at the back, it's known as the dorsal root or posterior root. This here in front is known as ventral root or anterior root. Ventral and anterior, and dorsal and posterior are synonymous for most parts of the body. These two roots join, and where they join, that area, just this short stump, is actually the spinal nerve. You will also notice attached to this dorsal root there's a little swelling present here. That swelling is known as a ganglion, dorsal root ganglion. Just like gray matter, ganglia also contain nerve cell bodies. So if you notice, you can see this dot over here, so it tells you it's the sensory axon cell body. Okay, can you see that dot? This spinal nerve then divides into two branches. These branches are known as rami. So this becomes the dorsal ramus and this becomes the ventral ramus. Dorsal ramus supplies the posterior aspect of your body. The ventral ramus supplies the anterior aspect and the flanks, the lateral part of your body. So let's look at what happens in this. And let's look at some of the things. The first thing to remember is that the dorsal root is the sensory root. Sensory, or what is called afferent root. That means all sensory fibers have to enter through the dorsal root. The ventral root is called the motor root or efferent root. All fibers which are exiting the spinal cord will leave through the ventral root. Okay, so look at this picture again carefully. So imagine that you want this muscle, the biceps, to contract. Information will begin from this area of the spinal cord, and since this is the ventral root, an easy way to remember is this is called the ventral horn of gray matter. So notice up here, this is the ventral horn. So cell bodies from the ventral horn send out their axons, which will pass through the ventral root, and these fibers will come out. They will go through the spinal nerve, they will travel into the ventral ramus, and they will go to supply the biceps, which is on the front of the body wall. Imagine you had to have something happening on the back, your back muscles. Let's say you had to contract your back muscles, you're doing yoga or doing something. Same way, the fibers will be, the cell body is in the ventral horn, pass through the ventral root, get into the spinal nerve, and now it will go into the dorsal ramus, because the dorsal ramus supplies the back of the body. So it will go into the dorsal ramus and supply the back muscle, and that same thing is shown here. So you can see skeletal muscle of back, skeletal muscle of limbs and trunk. So from the anterior horn, they either come to the front if you want the front to be stimulated, or they go to the back skeletal muscles if you want that. Now suppose you had something happening on the front of your body wall, some sensation which has to be perceived. So from the receptors, the fibers will start, they will go into the ventral ramus, go into the spinal nerve, but now they will go into the into the dorsal root, where they will have their cell body. So you can see their cell body there, and the fiber is actually like this. So this is the cell body and going this way. So this is coming from the periphery, which is this one. This is what you're seeing here, and this is what is its central process, which is going into the spinal cord, where it will synapse with some cells over there. So look at this from the front. Say somebody pricks you on the front, the impulses will be carried. Since it's the front of the body, it will go into the ventral ramus, go into the spinal nerve, then it will go into the dorsal root, where its cell body will lie in the dorsal root ganglion, and the other process now the dendritic process will go in and synapse in the dorsal horn of gray matter. So this part here is called the dorsal horn. Okay, so if you can see here from this picture, it tells you that this dorsal root has sensory axon and cell bodies. The ventral root has just the axon of the motor neuron, because the cell body is within the gray matter. Do you see that? Here the cell body is within the gray matter. Okay. From this, what can you see? That a spinal nerve is mixed because it has both motor and sensory fibers. How about the rami? Are they mixed or are they like the roots? Mixed. So the rami, dorsal and ventral rami, carry both sensory and motor information. Okay. So think of these rami and the spinal nerves like a telephone cable. You get incoming calls and you're getting outgoing calls. And then let's say there was an operator. Nowadays you don't have operators. At some point they branch off. So incoming calls go one way and outgoing calls go the other way. So the roots are where they split. The rami are where they are together. Okay. Now here, now this is, I'm showing you again in this figure you're looking at the meninges of the spinal cord. So again you can see the three layers. Dura is outermost, arachnoid is middle, pia mater is the innermost. It's very closely adherent to the spinal cord. You can't really separate pia. Pia actually means loving mother, and in between them are those various spaces that I described. And I also want you to see, this is a picture here. Remember, these were the roots. So this was the dorsal root, this is the ventral root, here's the spinal nerve, the dorsal ramus, the ventral ramus. These roots actually, when they attach to the spinal cord, they really don't attach by one root like I showed you up here. It's not just a single root. They actually attach by rootlets. So can you see that? This one root really breaks up into rootlets so that the fibers, the axons, can kind of exit this way or they have to go in that way. And here I want you to see this picture on the relationship of the spinal cord, spinal nerve, ganglia and all that to the vertebral column. So this is the vertebral foramen inside. You know, in a vertebra there's a big hole in the center which is known as a vertebral foramen, and when many vertebrae are lined together that becomes a canal, and the spinal cord is present in that canal, it's protected. So notice how the entire spinal cord is in that vertebral canal. The rootlets are in the canal, right? The dorsal root and ventral root is in the canal. This dorsal root ganglion is actually, and the spinal nerve is at the point where the vertebra allows the exit of the spinal nerve. So they're kind of right here on the, in a place which is known as the intervertebral foramen. That means vertebral foramen. That means the foramen between vertebrae. So if there's another vertebra below, when the two kind of articulate, there'll be a foramen. So if I was to just show you from the side, if this is one vertebra, this is the other, like this and this way. So this is where the spinal nerves exit. Okay, so they are present in the intervertebral foramen, and outside the rami, you can see the rami are outside of the spinal cord. This is a ganglion which I just want you to pay attention to, the sympathetic trunk ganglion. We'll do later. That is also outside of the spinal cord. And can you see this dorsal root ganglion? It is present in the intervertebral foramen, but it is outside of the central nervous system, right? This was the spinal cord. It's outside the spinal cord. The reason I'm kind of showing you this dorsal root ganglion, I'm showing you the sympathetic chain ganglion, is because when you do the embryology part, you should remember that whatever lies inside the central nervous system develops from something else, whatever lies outside develops from something else. So there should be a reasoning in your head as to why they develop differently. Okay? Okay, let's look at the spinal nerve distribution. So here I'm just showing you again a typical spinal nerve on one side. Not all spinal nerves are typical, but this is a typical spinal nerve taken, say, from the thoracic region. So again, look at it: dorsal root, ventral root, dorsal root ganglion, the spinal nerve dividing into a dorsal ramus, a ventral ramus. Notice how the dorsal ramus is so short. Look at the ventral ramus, so long. And that is because the ventral ramus supplies, this ventral ramus supplies the limbs and all of the lateral side of your body wall. The dorsal ramus, this area, just supplies a small area on your back, so on either side of the vertebral column. So it just supplies the back muscles, the true back muscles, and it supplies it gets information from the skin in that area, like a strip of skin on either side of the vertebral column. So very small. So that's the reason why the dorsal ramus is much smaller than the ventral ramus. And I also want you to pay attention, look at this, because remember I said these rami were like cables, telephone cables, getting incoming information and outgoing calls. So look at this word, this is where sensory information is coming. So in this ramus, in either one of these, you have fibers which either are carrying information this way, or they are fibers which are carrying information out. So wherever you see the word cutaneous, that means it's going to the skin, it's carrying information from the skin. Wherever you see here, so you can see medial, cutaneous, lateral. Wherever you see the word muscular, it's carrying information to muscles. So this is efferent. So again, in the ventral ramus, again you see a muscular branch, you see many muscular, and then you see cutaneous branches. Okay. So this is just to show you how fibers are traveling in both directions. The cutaneous fibers carry information this way, the muscular fibers are carrying information that way. Follow? Okay, now let's come to the embryology. So this is the folded embryo. Remember I showed you that video where the embryo was totally folded? So let's look at it. This is the ectodermal layer. All of this is the mesodermal layer, and then up here is the endoderm. All of this, mesoderm is very large, it's divided into different parts, but all of this in orange and pinkish, this is all mesoderm. Okay, this is the endoderm right in the middle, over here right inside, which forms the lining of the tubes. The mesoderm forms muscles, bones, dermis of skin, kidneys and other things, but for now you need to know muscle, ligaments, bone, dermis of skin. And then the ectoderm forms the outer epidermis of skin and epithelial elsewhere. Epidermis of skin for now. Okay. Here, remember when we were looking at the video, we were looking at the neural tube forming. So if you look here, you can see this part here is the neural tube. Notice this is the neural tube. On either side of the neural tube, when the neural tube develops, actually it develops like this. There's a fold. This part here is called the neural crest, and then this tube kind of fuses like that and becomes a tube, and these neural crest cells, they actually separate and go out. So that's what you're seeing here. So this is the neural tube. On either side is this neural crest cells. Okay, those were the separated, they were from the lips of that neural tube. Then I also want you to look at, so you can see it's right in the center on either side. So, and remember your brain and spinal cord, the neural tube forms the brain and spinal cord. That's in the central axis of your body, and what surrounds that are muscles. So here you have a part of the mesoderm, and that part of the mesoderm is known as dermatomyotome. So look at this, dermatomyotome. This orange area is called dermatomyotome. From the name itself, you should be able to, if somebody asked you what would it develop into, derma for dermis of skin. So this gives rise to dermis of skin. Myotome, myo is muscle, so it gives rise to muscle. This dermatomyotome gives rise to skeletal muscle. Okay? What is not shown in this, and you will see it at a later stage, but I want to introduce the term here, is this, like a deeper pink area. This is called sclerotome, and from the word sclerotome, this gives rise to bone and cartilage. So this is how, imagine the vertebral column coming from here will develop around this neural tube. So that's how it helps to protect the neural tube. Now let's look at some other important things over here.
What is the sclerotome?
Sclerotome is part of this mesoderm. It is closely attached to the dermatomyotome. It gives rise to cartilage and bone. Sclerotome, cartilage and bone. Now look at this dermatomyotomes, and two things which you need to kind of pay attention to. There is something known as epaxial muscles and dermis, and something down here known as hypaxial muscles and dermis. So from this dermatomyotome, some of this mesodermal tissue migrates to the top, and it forms the muscles of the back and the skin, the dermis of the back. Ep meaning above. So that's how you're going to remember. What does epaxial part of the dermatomyotome do? It gives rise to muscles and dermis of the back. Okay, because this is on top, epaxial. Hypaxial is all the rest of the muscle, which is the trunk and the limbs. So hype meaning below, and if you think of it, if you were lying down, your back is on top and the rest of your body is below. So that's how you'll remember. Hypaxial is trunk and limbs, epaxial is muscles and the dermis of the trunk, of the back. Okay, remember, don't say skin, because skin has epidermis and dermis. This only gives rise to the dermis. Now let's see how these muscles are supplied. Whenever you have muscle, you have to have a nerve supply in order for the muscle to act. So remember, we just did how those spinal nerves had those motor or efferent fibers. So where do they actually come from? You saw, if I go back to this slide, and look, we had this from this anterior horn, the motor fibers were coming out. So where do they actually develop from? Look at this picture. This is the neural tube. This part is anterior, this part is posterior. Look at it. From this anterior region of the neural tube, axons begin, nerve cell bodies start, their axons pass out. So they are going into the back muscles or the epaxial muscles. They are going into the trunk and limb muscles, which is hypaxial muscles. And that's why looking at the picture is very important. So look at this axon of motor neuron projects to muscles developing from dermatomyotome. Do you see that? And look at this somatic motor neuron cell body in anterior region of neural tube. So if you are asked where do the motor neurons develop from, they develop from the neural tube. Okay, so you can see on both sides they are developing. And notice the position, because you saw the ventral horn there. So therefore here also it's from the anterior region. Now let's look at sensory fibers. So up here. So here I want to again go back to this. See the sensory fibers, the cell bodies were outside the central nervous system. Did you see that? They are outside the this is central nervous system. They are outside it's part of the peripheral nervous system. So they are outside. And here the sensory fibers, the cell bodies develop in that neural crest cells. Okay, so again, so you can see a somatic sensory, which are also known as afferent. They develop from neural crest because it's outside. And what will they do? You can see they send some processes to the periphery, and the second set of processes go to the center, right? Just as we saw here. Look at this. One process is in the periphery, one process is in the center, right? This is the cell body, isn't it? Here's a process which is bringing information from the periphery, the cell body, and then the next process carries it to the central nervous system. So the same way, this is how you explain the development. So look at it. Here's the cell body developing from the neural crest cell. This process is the one which is bringing information from the periphery, either the dorsal or the ventral aspect of the body. They have their cell body here, and then the next process, the central process, goes into the central nervous system. Okay? So what you should remember is that the sensory fibers, sensory neurons develop from neural crest. Why? Because they are outside of the CNS, and the neural crest is not part of the neural tube, it's outside of the neural tube. Okay? Okay, so so here's it. So you can see sensory or afferent neurons develop from neural crest, motor neurons were developing from neural tube. And just as a review, what is sensory information? It's information of pain, temperature, touch, Proprioception is what is known as joint and muscle sense. That means and muscle sense. So for example, if your joint is flexed and your eyes were closed and somebody asked you which position your joint is, you'd be able to tell. Muscle sense is knowing how much the brain knows how much tension has developed in the muscle and so on. And this information is from the somatic or periphery, and visceral sensations are a little different, but I'm going to mention it here. Visceral sensations are respond to stretch, ischemia, which is lack of blood supply, and visceral sensations also respond to chemicals. So chemo, you have what are called chemoreceptors. So chemoreceptors, okay? So that's what visceral sensations respond to, and we'll look at that later. Now let's look at, so we did muscle here, so now let's look at something known as dermatome, and this is to do with the skin, the dermis of the skin and what it is supplied by. And again, if you look at the spinal, remember the spinal ganglion, which was outside or known as the dorsal root ganglion, which was this one. It's called the dorsal root ganglion, or also known as the spinal ganglion because it's attached to the spinal nerve. Develops from the neural crest, and it's carrying the sensation, as you can see here, from the periphery, from the skin. The sensation passes up here. It has its cell body in the spinal ganglion, and then it enters into the neural tube or the central nervous system. Now the area of this dermatomyotome, the derma part, is the one which develops into the dermis of the skin, from where this sensation is carried. And the dermis of the skin develops as strips in all parts of the body, and each area of skin is supplied by one single segment of the spinal cord. So that is known as a dermatome. So as a definition, a dermatome is the area of skin which is supplied by a single spinal level, or what we also call segment. And if you look at it, if you look one side, you can say it also, you can say a dermatome is an area of the skin which is supplied by a single spinal nerve on that side. So you can say on the left side it will supplied by a single spinal nerve, on the right side by a single spinal nerve. And remember, from a spinal segment you have two spinal nerves coming out, right? So from, for example, what I'm trying to say is that at say T2 segment of the spinal cord, so if I was to draw the spinal cord like this, at T2 segment of the spinal cord, you'll have T2 nerve coming out this side, the right side, T2 nerve coming out the left side, right? So this area is supplied by this spinal segment, or we can say it is supplied by a single spinal nerve on this side and single spinal nerve on that side, okay? So that's what is a dermatome, and that's an important concept to remember. These dermatomes are mapped out, as you can see, in the body. They are mapped out. This area, for example, your neck area is C342 to C5. The thoracic area and right up to the abdomen is from T2 to T12. You can see the lower limbs are from L1 to, they go right up to the sacral levels. If you look at the upper limb, it is from C5 to T2. So this is how it's mapped. We know these areas are supplied by these spinal levels or spinal segments, and it helps us because when we want to test, say someone is involved in a car accident and you want to know which area of, and they have a spinal cord injury, you want to know which area of the spinal cord is involved. Of course you can do all your MRIs and so on, but you can also test the skin. So let's say the T2 to T4 segments were involved. So if you tested the skin and you pricked that person, or you touched that person and asked them, do you feel it? And they say no, then you know, okay, T2 segment is involved, or T3 segment is involved, and T4 segment is involved. So you can know that. So that's an important thing that is done by clinicians. Now you can see each strip is is specific to itself, but there's often an overlap between adjacent strips. So where they kind of come close to each other, there is an overlap over here. So in this intervening part. So often the central area of each strip, so there are certain parts of a strip up here or certain parts up here which are known as autonomous zones. Autonomous zones meaning that if you test in that area, you are sure that that segment is involved. So for example, if you tested the center of this part here, if you tested the center here, you know that okay, T3, if you go towards the edges, there could be an overlap between T2 and T4. Okay, so similarly, if you tested, for example, right here in the middle of the palm, C7, you're sure. You don't want to go towards the thumb or towards the little finger because again there's an overlap. So dermatomes overlap, adjacent dermatomes overlap, but there is a zone in each dermatome which is specific to that spinal segment. And here again I just labeled the sclerotome for you to understand that this is where the bone and cartilage will develop from. Now let's look at myotomes, which develop from the, again, dermatomyotome. They develop from the myotome part, and you remember the epaxial developed into the muscles of the back, the hypaxial into the trunk and the limb muscles. Now what happens is that a muscle doesn't develop, unlike a dermatome which develops from only one dermatomyotome. Muscles don't develop from an individual myotome. So if you take any muscle, let's look at this muscle which is the deltoid. This deltoid develops from two myotomes, C5 and C6 myotomes. So you can see it'll necessitate having two nerves supplying it. So it's very difficult to test myotomes because you can't test individual segments. And so instead of testing individual muscles, what you test are joint movements, because for example, muscles which move the shoulder joint, and we know this, muscles which move the shoulder joint, they involve the C5, C6 segments of the spinal cord. Muscles which move the elbow joint use C7 and C8, so it goes on like that. So instead of testing single muscles, because muscles do not develop from a single myotome, you test joint movements, and so if that joint movement is affected, then you think it's a possibility that quite a few muscles which cause that joint movement may be involved. Now while we are here at this myotome, I want to explain the purpose of plexuses, which we'll see later on. You see, because I said that muscles develop from many myotomes, so if you look at this, imagine this muscle, deltoid is only developing from two myotomes, but you may have a muscle which develops from 4 myotomes. So let's say these are 4 myotomes and they give rise to a huge muscle. And this is the nerve which supplies, which is from the myotome. So you see, you can see that this muscle will have 4 nerves supplying it. Now let's say you had another muscle which developed from these 3. So you have this muscle developing from these 3. So it will have these 3 nerves. So you can see that each muscle, if it is supplied by so many nerves, it's going to be a big traffic jam, by the time it gets to the limbs. So what happens is, in order to prevent that, nature has done a beautiful thing. What it does is that if these 4 nerves were somehow able to join together like this, form a single nerve, this nerve will have fibers from 1, 2, 3, 4 segments, and then now this nerve goes and supplies the muscle. Okay, that's how plexuses are formed. The word plexus means a network. So you have networks which are formed, and in that network you have many fibers joining to form a single nerve, which is thus carrying fibers from all these, and then this nerve, only one single nerve, will go and supply the muscle. Okay, so it's good to understand the reasoning behind why some of these things happen in our body. So all this time we were doing the somatic nervous system. So now let's look at the visceral nervous system. Viscera means organ, viscous, it comes from the word viscous. So visceral means organ. There's some things to remember. When you use the term visceral, you mean organ, you mean either smooth muscle, if it has muscle, not all organs have muscle. If it has muscle, it could be smooth muscle or cardiac muscle. It's involuntary, and it is the motor supply to the muscle is through the autonomic nervous system. Okay, so the visceral nervous system has two components. It has So the visceral nervous system has two components, okay? There's a sensory component and there's a motor component. The sensory component is known as general visceral afferent fibers, sensory fibers. It's coming from the viscera, so it's known as visceral. It's called general because these are general sensations. They are not special sensations like taste or smell, okay? Like the somatic, for example, just to go back, the somatic nervous system, these sensory fibers that we were talking about, these are called general somatic afferent. And the motor fibers were known as general somatic efferent. So in the visceral nervous system, this is not part of the definition that I told you. Remember, I said functionally it was divided into a somatic and autonomic. So this is a little different. So let me explain this. So the sensory component is known as general visceral afferent, and it responds not to touch, pain, temperature like we did in the skin, but it responds to chemicals like chemoreceptors. It responds to stretch, which is the mechanoreceptor. For example, when you have colic, when somebody is suffering from a stomach ache or colic, it's because the intestines have been expanded, most often due to gas, and it responds to ischemia. When you have heart attacks, it is because the cardiac muscle is deprived of its blood supply, and then the patient feels pain. So these are the three types of visceral sensations that the brain can process. Okay, so this part is known as sensory component of the visceral nervous system. The motor component of the visceral nervous system is what is known as the autonomic nervous system. Okay, so again, in this first definition that we have here, which I had here, the somatic and autonomic, you can't always take all parts of the nervous system and very neatly kind of classify them in here. Okay, so when I said functionally it was divided into somatic and autonomic, I could easily tell you somatic is to do with voluntary, autonomic is to do with involuntary muscle. Somatic has parts which also carry sensation. It uses all of the CNS and PNS, and I told you the autonomic did this. Now here, if I could add, I would add something like I might want to do a visceral, there's a visceral afferent, but then it'll just kind of confuse the issue, so often we don't classify it here at all. Okay, so like I said, the classification doesn't have neat slots to include everything in it. So what I want you to see here is that the visceral nervous system, which means that the nervous system which is responsible for receiving and carrying information to the viscera, has two parts. The motor component is the autonomic, which we described earlier, and then there is the sensory component, which is called general visceral, and we don't very neatly classify it into any of those parts. And this has two, sympathetic and parasympathetic. So let's look at the autonomic nervous system. And if you remember, I told you that the autonomic nervous system does not utilize all of the central nervous system or all of the peripheral. It only utilizes parts of it, right? So let's look at what the sympathetic and parasympathetic utilize. The sympathetic nervous system utilizes just about the central portion of the central nervous system, and it is in the spinal cord. So from the T1 to the L2 segments of the spinal cord, it just uses that part of the central nervous system, and then from there it goes out through all the spinal nerves. So it uses in the central nervous system, and let me change the color. In the central nervous system, it uses from the T1 to L2 segments of the spinal cord, does not use the brain or the rest of the spinal cord. And in the peripheral nervous system, it uses all the spinal nerves. The sympathetic, any structure which has a blood supply will have to have a sympathetic supply, because the sympathetic nervous system supplies blood vessels. So there are very few structures in your body which do not have a vascular supply. For example, the epithelium is avascular. The cartilage, other than the perichondrium, is avascular. The lens of your eye is avascular. They don't have a sympathetic supply, but everything else does. Okay? The parasympathetic, so coming back to the sympathetic, I forgot to say one thing. So since it goes from the thoracic to the lumbar segments of the spinal cord, we often say the sympathetic is often called the thoraco-lumbar outflow. And if you remember it this way, it might help you. Sympathetic is thoraco-lumbar outflow, because it's arising from the thoracic to the L2, T1 to L2 segments of the spinal cord. The parasympathetic arises from areas in the brain and a few segments in the spinal cord, and therefore the parasympathetic is often called cranio, to tell you that it's from the brain, and spinal cord, sacral outflow. So this is its central nervous system component. Okay, so again, can you see it's not utilizing the entire central nervous system? So craniosacral outflow. In the cranium, it is associated with what are called nuclei, and these are nerve cell bodies of cranial nerves 3, 7, 9 and 10. And in the spinal cord, it is associated with the spinal segments 2, 3 and 4, sacral 2, 3 and 4. Okay, so that's the sacral part. Cranio is these, sacral is sacral 2, 3, 4 segments of the spinal cord. And the peripheral nervous system, part of it is these three nerves. In the brain, it was the nuclei of these three nerves. Nuclei meaning there are areas in the brain where these cranial nerves originate from, and they have their cell body. So these were the nuclei of these cranial nerves. And then it travels with these 4 cranial nerves, so that's the peripheral nervous system part, and it travels with the spinal 2, 3, 4 sacral spinal nerves. So let me repeat this. So what I'm trying to say is that the parasympathetic, the cranial component is in the brain, and in the brain it is associated with gray matter, which has to do with cranial nerves 3, 7, 9 and 10. And in the spinal cord, it is in the sacral 2, 3, 4 segments of the spinal cord. So that's the CNS component. How does it get out of the brain? It gets out of the brain using the peripheral nervous system. So it uses the very same cranial nerves that it is associated with here, which is the peripheral nervous system part is the 3, 7, 9 and 10. The same thing, I'm writing it differently. Okay, and here it comes out with sacral 2, 3 and 4 spinal nerves. Follow? Just as the sympathetic used all the spinal nerves, but I didn't mention any cranial nerves, right? The parasympathetic uses 4 cranial nerves and 3 spinal nerves to get out, and you can see all the parts that these 2 parts of the autonomic nervous system supply. They supply smooth muscle of all the glands, smooth muscle of all the organs. They supply cardiac muscle. And when I say supply smooth muscle of glands, when glands secrete, actually if you look at a gland, and this is a gland in cross section, glands actually have a small little cell here called the myoepithelial cell. So sympathetic or parasympathetic will supply this part of that gland. This will contract and the gland will be squeezed out and it will secrete. So they supply, you can see smooth muscle, cardiac muscle and glands. And in glands you should understand that actually there's a small muscle there which it supplies. Okay, and they have opposite actions, as you can see from this picture. The sympathetic is always in times of stress. So anytime you need a stressful reaction from your body, the sympathetic becomes overactive. When your body is at rest, then the parasympathetic is acting at that time. And while looking at this, I also want you to see one thing. And if you notice, the autonomic nervous system is, as we said, it was a motor system. It only goes to muscle. It does not carry information back from the areas it's supplying. You have the afferent fibers which travel with it, but they don't belong to this system. Okay, so autonomic is a motor system. It is also has an interruption in between, and that's what I want you to see in this image. So let's look at sympathetic. So you can see that it's beginning in the thoracolumbar. The neurons begin here in a part of the spinal cord in the gray matter. They pass out, and what they do is that outside the spinal cord there are ganglia present. You can see this ganglia is like a chain. It's called the chain of sympathetic ganglia, also known as the sympathetic trunk. These fibers will synapse here, and then a second set of fibers will pass out. That's one way it does it. Or it may synapse at another ganglion present somewhere else. So there's always an interruption. So there is kind of what is called a two neuronal pathway. So if you look at this system, you'll have one part beginning from this, and I'm doing only the sympathetic. It begins from here, it comes out through the ventral root, it will synapse in a ganglion, and then from here another fiber will start and go to its target area. So you can see that this fiber is before the ganglion, this fiber is after the ganglion. So these are often known as preganglionic, or also known as presynaptic. These are after, so they are known as postganglionic or postsynaptic. Okay? And look at it here. See this? Just look at this one. Passing out, preganglionic, then postganglionic. Here they have synapsed here, second fiber started, postganglionic. The same thing happens for parasympathetic also. If you look, they begin here, they come out, they synapse in a ganglion, and then the postganglionic fiber starts. Begin here, synapse, go. Those from the sacral region, they come out here, and the ganglia in the parasympathetic are often located within the walls of the organs themselves, and then the postganglionic starts out. So postganglionic are really short in the parasympathetic. Okay, we'll be going over this again. Now, if you notice, all of these ganglia in the sympathetic, whether it is here or whether it is here or whether it is here in the parasympathetic, they are all outside of the central nervous system. So, if you look at it embryologically, you can understand that they will develop, these ganglia of the autonomic nervous system will develop from the neural tube. Remember, the structures which developed from neural tube were from anything which was outside of the CNS. We already saw that the neural tube gave rise to the sensory ganglia or the sensory axons. Remember the somatic afferent? So it gave rise to the sensory neurons in the somatic nervous system. So now it also gives rise to, here in this case, it gives rise to the motor neurons which are in the autonomic. But which motor neurons? It's giving rise to those which are in this ganglia, the postganglionic motor neurons. So it's giving rise to the postganglionic motor neurons. Okay, and let me go back and let me show you what this might be a little confusing. So let's look at it this way. So let me go back here to this picture. Okay, sorry, if I said neural tube gives rise to this, that was a mistake. The neural crest gives rise to the sensory neurons, and it gives rise to the postganglionic motor neurons, which you can see over here, because they are outside. So if we go back here to this, I don't know why it's not going back to this here. So here, these are the ganglia which are present outside of the central nervous system. Here are the ganglia, and remember, these in the ganglia, the cell bodies gave rise to postganglionic fibers. So therefore, the neural crest cells give rise to postganglionic motor neurons outside the central nervous system. The neural tube gives rise to everything which is in the central nervous system. So what it will give rise to is the cells which originate in the brain, the cells which originate here in the T1 to L2, and the cells which originate here in the sacral 2, 3, 4, and these actually arise from the lateral aspect of the spinal cord. So in this aspect here is where the sympathetic will arise, or the parasympathetic in the sacral segment. So the fibers will actually pass out like that. Okay, and we'll see this again. And so here you can see how from the neural tube, you can see these cells. These are the preganglionic. They pass out, they go and synapse in the ganglia, and so these cells arise from the neural tube. Then these are preganglionic, and when they synapse, the postganglionic neuron which is in these ganglia will begin, and they will go out and go to the respective organs. These postganglionic neurons arise from the neural crest because they are outside the central nervous system. Okay. Now let's look at the sympathetic nervous system in a little bit more detail. So here you can see it originates from the T1 to L2, so thoracolumbar region. It passes out into the spinal nerves at that level from T1 to L2. So these fibers which pass out with the spinal nerves, these fibers are known as white rami because they are myelinated fibers. These are called white rami communicans. And these are myelinated. So they pass out. So you will have how many white rami? There are 12 thoracic segments and 2 lumbars and 5 lumbar, but it only uses 2 of them. So there are 14 white rami, right? Now remember, the autonomic nervous system is a 2 neuronal pathway, right? 2 neuronal pathway. That means it has to stop somewhere, like there has to be a toll booth along its way where a fiber passes out of the CNS, stops. This is preganglionic, and then a postganglionic goes to the final target organ, right? So this is a two neuronal, 1, 2. So let's see how that happens. Now all by the side of the vertebral column, by the side of the vertebral column, here you can see by the side of the vertebral column, there are ganglia present where the synapse occurs. These ganglia, because they are by the side of the vertebral column, they are known as paravertebral ganglia. The word para means by the side of. So you have this whole thing, and each ganglion is connected to the other by a little stem like this. So that's why this is often called the sympathetic trunk or sympathetic chain, because it looks like a chain. Now the white rami will synapse in these paravertebral ganglia, and then they will go to their areas which we will see. But sometimes some of these white rami do not synapse in these paravertebral. They kind of just pass right through, and instead they go and synapse on ganglia which are present in front of the vertebral column. And actually in front of the vertebral column, the aorta is present, and so up here there's the aorta present, and in front of the aorta you have certain ganglia present which are known as prevertebral ganglia, pre meaning in front of. So some of these fibers will pass through the paravertebral, they'll go and synapse in this prevertebral ganglia, and then the second neuron will pass and go to the organ it needs to supply. So again you can see it as a 2 neuronal pathway. Okay. Now just to understand how the sympathetic nervous system behaves, I have this little slide which I want to show you. So imagine you were going, and if you think about things logically, it kind of helps. So let's look here at what all the sympathetic nervous system supplies, and then we can work out where all it has to go. Sympathetic nervous system supplies blood vessels all over the body. So it supplies blood vessels all over the body, which means it has to supply blood vessels of the skin all over your body, as well as other blood vessels anywhere else. Sympathetic nervous system, it supplies the smooth muscle of the blood vessels. It supplies a muscle which is called the erector pylorum muscle, which is the muscle which makes your skin stand on end. Okay, it's called erector erector pylorem, which makes your hair stand on end, sorry, not skin, erector pylorem muscle. And we said smooth muscle of the blood vessels, and it supplies the sweat glands. And in addition to all of this, it also supplies the smooth muscle in the various organs. Now this, the erector pylorem, many blood vessels and the sweat glands, this is present on the skin on the surface of your body. What supplies the skin on the surface of the body? The spinal nerves, right? And the cranial nerves in the head and neck area. The skin, remember, the sensory information was being carried, so that the spinal nerves were going, that's where they were going, and the cranial nerves. So the sympathetic nervous system has to go to the periphery of the body. So if you ask why cranial nerves, I'm just saying that cranial nerves supply the skin of the head and neck area, and spinal nerves supply the skin of the rest of the body. So that's how they supply it. So the sympathetic nervous system has to somehow supply all the skin everywhere. So for the skin of the body below the head and neck, it uses the spinal nerves. It doesn't use cranial nerves, as we said, but we'll see how it still has to go to the skin there. So if it doesn't use cranial nerves, it has to find another way to reach the skin of your head and neck, right? Then the sympathetic, as you can see, supplies all these organs, the smooth muscle of these organs. So it has to go inside the body cavity to supply them. So let's see how the sympathetic does that. And for that, I have this example that you can see. So imagine you were a bunch of people who had bought tickets, sitting in a waiting area going to see the US Open. And this is the waiting area. You have just so many exits that you can get out from. So imagine these are the white rami. Okay, so you can only get out from here. But now once you get out, you want to go and sit maybe on the north end of the court. You want to sit right across here, or you want to go to this side, or you want to sit on the south end of the court. So what happens is that you go out this way. Those who are directly in line will show their ticket to a person waiting here, and then from here they will pass out. So these are what are called white rami, and these, after you've shown your ticket, these post-ganglionic fibers are known as gray rami. Okay. So again, to show you here, just to go back to this picture, these were white rami, and then when the post-ganglionic, all these are known as gray rami, these fibers, right? Post-ganglionic is gray rami, pre-ganglionic is white rami. Now some of these people, some of these guys who were sitting here, they wanted to go to the north end. So what happens is that instead of showing their ticket here, they just pass through like this, and then they show their ticket here and then go out. Some of them who want to sit here maybe at the south end, they come here, they just pass through these guys, show their ticket, and then come out. So you can see that these white rami can actually get into the ganglia, then they travel up, show their synapse here and get out. They come here, synapse here, and get out. Okay? Some of these were just going directly across like this. And let's say you had some special people who wanted to go and meet Roger Federer, who was sitting here in the players' lounge, and after meeting him, you then wanted to go to your place where you're sitting. So what do these guys do? They come here, they actually pass right through. They don't show their ticket anywhere. They show their ticket here, and from here they enter the players' lounge, meet Roger Federer, and then go to wherever they have to sit. So if we said that these were what were called paravertebral ganglia, these are what are called prevertebral ganglia. So you can see how the parts which go to the prevertebral will go across like this. Right? They don't synapse here. You only synapse once. So instead of showing their ticket here, these guys went all the way, they synapsed here, and then they went through. And here, instead of a nerve, the spinal nerve, because the nerves are not present here, they use these blood vessels to get to their organs that they're going to supply. Okay? So this is kind of briefly on thinking if you were to kind of use it in everyday life. Now let's say some people wanted to sit, there's a balcony up here somewhere, and some people wanted to go there. So here what they do is they go here, they synapse here, and then through a tunnel they pass through and then go to the balcony. So this is imagined for the head and neck area. Okay, because there are no spinal nerves in the head and neck. We said that the sympathetic didn't use cranial nerves, so somehow it kind of uses something to get to supply the skin in the head and neck area. Now let's put that in perspective and see how it does it with, actually does it in the body. So here we are looking at the ones which went right, at their respective levels. So we're looking at these fibers. So you can see they are starting in this area. Remember I said the sympathetic fibers don't start in the anterior horn of the spinal cord. They start in this area which is known as the lateral gray matter or lateral horn. Lateral gray matter. Okay, excuse the spelling. So they start there. So look at the fiber. It starts there, has to exit through the ventral root because all motor or efferent fibers exit through the motor root. They travel in the spinal nerve, and along this ventral root is where the this sympathetic ganglion is hanging. So it enters through this white ramus, synapses there, passes out through the gray ramus, and it enters the ventral rami, and it will also enter the dorsal rami because it has to supply skin on the back as well as the front of the body, right? Remember the rami were mixed, right? So if they carried motor and sensory of the somatic nervous system, they also carry motor fibers from the sympathetic nervous system, and that's for the blood vessels. So see what all it supplies to sweat glands, smooth muscle of blood vessels, and erector pili muscles. Okay, so this is what happens from T1 to L2. Just go along their respective levels. Let's see what happens at the ones that have to go up or go down. So they are going to areas above T1 or below so above T1 or below L2 segments. Okay, so here let's say from the T10 segment of the spinal cord, it travels. Oh, I'm here. So above T1 and below L2, so you can see these fibers, they have to only exit from the T1 to L2. Remember, white rami. So they exit from T1 to L2. So notice they get into this as white rami, but they travel up in the chain till they go to a ganglion which is above T1, synapse there, and then they do the same thing. They'll get out through the postganglionic fibers will get out through the gray ramus and join the ventral rami and join the dorsal rami. So you can see that you have white rami only from T1 to L2, but all the spinal nerves have gray rami. So one way to remember it is gray is greater. So you have more gray rami than you have white rami. All spinal nerves have gray rami, but only T1 to L2 have white rami. Let's look at then the ones below. So then again they exit from T1 to L2. They travel all the way down. Oh, they're showing you on this side. So they travel all the way down, synapse at a ganglion lower down, and then the postganglionic fibers will start. Remember, it's only showing you ventral ramus, but it has to go through the dorsal ramus also to supply the skin at the back. Okay, so this is how fibers will supply above and below the levels. Now what about, remember I told you about the skin of the face, it doesn't go with cranial nerves. So here what happens actually is that in the region of the face area, the fibers go up to the cervical ganglia. There are only 3 cervical ganglia, you don't have all C1 to C8. They synapse in the superior cervical ganglia, and then the postganglionic fibers, they actually travel out, and there's a blood vessel, the internal carotid artery with its branches, or the external carotid depending on which area you're supplying. These postganglionic fibers, they wrap themselves around the blood vessels, and that's how they supply the skin of the head and neck, because these blood vessels will supply areas of the skin of head and neck. Since they cannot use a nerve to reach there, they wrap themselves around the blood vessels, and with the blood vessels they go to supply the head and neck areas. Okay, so that's how they reach the head and neck portion of the body. So let's look at then what else that does it do. Now how about, so we've taken care of skin for the whole body. Now let's look at the organs. So let's look at what happens at the thoracic level of the organs, where you have the heart and you have the lungs. So here from the T1 to T4 segments of the spinal cord, the fibers, the preganglionic axons start again in this lateral horn. They enter through the white ramus and get into the sympathetic ganglion at that level. They synapse there. The postganglionic fibers, they just pass out of the ganglion. They just pass out of the ganglion. Look at this. They're just passing straight out of the ganglion. They don't go back into the spinal nerves. They pass out of the ganglia and they form nerves which are known as cardiac nerves, or in the case of the lung, we call them pulmonary nerves, and they actually form a plexus, which means a network, and that's how they are able to go supply the muscle of the heart, or in the case of the bronchi and the lungs, they go and supply the smooth muscle there. Okay, so this is the second or third way of distribution of the sympathetic fibers, passing postganglionic fibers passing right out of the ganglia. Let's look at the other thing that they do. So far we have used the sympathetic chain. Now let's look at the ganglia which have to go into, remember the players lounge where you have to go and show your ticket. So here we have the sympathetic nerves which are destined for the organs within the abdominal cavity. So what they do is that the fibers again begin from the lateral horn. They pass into, as white rami, they pass into the sympathetic ganglia, and then instead of synapsing they pass right out. So they are still preganglionic. We don't call them white rami, we only call it white ramus till the point it's connected to the ganglion, but these are still preganglionic. They haven't synapsed. They pass out as nerves. These preganglionic fibers form nerves which are known as splanchnic nerves. The word splanchnic is to do with organs. So they form splanchnic nerves, and these are called greater splanchnic, lesser splanchnic, least splanchnic. You can see lumbar splanchnic nerves, and then in the sacral region you can see sacral splanchnic nerves. So all these fibers will pass out, and what do? Because they're still preganglionic, they go and synapse on those prevertebral ganglia. Remember I said there were those prevertebral in front of the aorta that, before the lounge you show your ticket. So they synapse here, and then from here the postganglionic fibers go to the respective organs. Okay. Now lastly, and what this is, at this point it's not necessary for you to remember, but just at some point, the greater splanchnic nerves comes from the T5 to T9 segments of the spinal cord, lesser is T10 to 11, and least are T12, but you can ignore that. Now the adrenal gland, the medulla of the adrenal gland is part of the sympathetic nervous system. So some of these fibers, what they do is that when they come out like this as these splanchnic nerves, they go directly. So if I was to show you somewhere here, let's say this, it starts out and comes this way and gets in here. It comes straight, these are preganglionic, they synapse on cells which are present within the adrenal medulla. And these are postganglionic neurons. There are no axons. Once they synapse, these ganglion cells itself, they act as postganglionic fibers, and they liberate epinephrine and norepinephrine, which is the neurotransmitter of the sympathetic nervous system. So that's the fifth way that the sympathetic system can act. Okay. Okay, so now let's move to the parasympathetic nervous system. This is an easier system. So as I said, it arises from the cranial and sacral part. So craniosacral. Remember, it's only connected to the nuclei of 4 cranial nerves up here, and those are 3rd, 7th, 9th, and 10th. And the sacral, it's sacral 2, 3, 4 segments of the spinal cord. So again, from the lateral horn in the spinal cord and from the nuclei in the brain, it passes out with these cranial nerves. And then again the postganglionic fibers begin, because they are ganglia. These ganglia, they're different names, and you'll do them when you do head and neck. These ganglia are all associated with the 5th cranial nerve. So the parasympathetic doesn't doesn't have any connection directly with the fifth. It's just that these ganglia are kind of hanging from branches of the fifth cranial nerve, and so when it travels with the third, seventh, ninth or 10th, somehow those nerves make connections with the fifth nerve, and it's the ganglia which are attached there, and then it synapses at the ganglia, and then the postganglionic fibers will pass out to go and supply the various structures in the face. Then the 10th, it passes down into the thorax and the abdomen, where it goes to supply these organs up here, and here the ganglia are present within the walls of the organs themselves. And from the sacral segments of the spinal cord, you can see these preganglionic fibers really large, and then they go and synapse again in ganglia which are present in the walls of the organs. Okay, so parasympathetic has a craniosacral outflow. In the cranial part, it travels with the 3rd, 7th, 9th and 10th cranial nerves, and the preganglionic fibers synapse in ganglia which are associated with 5th. Remember, 5th is not part of the parasympathetic nervous system. And just so that you understand what happens is, imagine this is the, let's say this is the 3rd cranial nerve, and somewhere here is the 5th cranial nerve. Okay, and let's say there's a ganglion which is hanging from the 5th. So this 3rd cranial nerve will somehow kind of make a connection with the 5th. So fibers traveling in the parasympathetic, and let me use this color, will go like this. So they're traveling with the 3rd, they enter the 5th, they synapse, then the postganglionic fibers start, and they're either distributed with branches of the 5th, or sometimes they may go back into the same nerve and get out. Can you see that? Okay. Okay, so yes, a good point that it's the 3rd, 7th and 9th which interact with ganglia which have connections with the 5th. The 10th is mainly for supply of the thoracic and abdominal viscera. So it actually just travels down. In fact, the 10th is a very, very long nerve. It's called, the vagus means vagabond, meaning going all over the place. So it actually passes into the thorax and the abdomen, where the parasympathetic fibers traveling in the 10th go and supply these organs. Okay. So far we were doing the autonomic nervous system, and remember we had talked of the visceral nervous system, part of which was autonomic, and we also talked of visceral afferent fibers, right? That means sensory information from the gut. So imagine, let's say for example, your appendix had a thrombus in the blood supply to the appendix, or your heart had one of the coronary arteries had a thrombus, so that caused ischemia, or your gut was stretched too much, so that causes the stretch receptors to be stimulated. So sensations from those areas have to travel back into the central nervous system in order for you to perceive that you have pain. So let's say this is part of the gut. So from the gut, the sensory fibers, which are known as visceral sensory or visceral afferent fibers, they travel. And how do they travel? It's like if for example, if say the Jones family was traveling in a car and was going to New Orleans. So, you just take a ride with them. You don't belong to the Jones family. You're just using them, right? So same way, these visceral afferent fibers, they use the pathway which has already been laid down by the sympathetic nervous system. So they travel with the sympathetic fibers, but in a backward direction, because they're going towards the central nervous system. So see here, they're traveling like this. They pass through these ganglia. They have nothing to do with the ganglia, in the sense they don't have any synapse or anything. They just go back, they enter the spinal nerves, they enter into the spinal ganglion, and they come and synapse in the dorsal horn. So can you see they behave very similar to the somatic sensory, the only difference being that the sensations are very different and they come from the organ. So for part of the way, their pathway is a little different. Okay. Now let's just, as a review, if you look at sensory fibers, whether the sensory fibers come from the body wall, whether they come from the anterior part of the body wall, exteroceptors means out receptors which sense pain, temperature, all those kind of sensations. Interoceptors are from blood vessels and organs. So whether they come from the back, from the skin of the body wall, on the front or skin of the body wall of the back, whether they come from blood vessels of the back, whether they come from blood vessels of the front of the body wall, or whether they come from the organs. All sensory fibers, if you look at the pathway, they all travel through the dorsal root. They have their cell body in the dorsal root ganglion. These cell bodies are derived from the neural crest cells, and they enter the dorsal root and then they enter into the dorsal horn. Okay? If you do a review of motor fibers, all motor fibers which are known as efferent fibers, whether they are called somatic efferent, which means they are going to skeletal muscle, or whether they are known as visceral efferent, which is the autonomic, they all pass out from the central nervous system. So they have their cell bodies either in the lateral horn, which would be to do with the autonomic, visceral motor, or they have their cell bodies in the anterior horn or ventral horn, which is the somatic motor. They all pass out through the ventral root, get into the spinal nerve, and then for muscles, skeletal muscles, they'll go into the dorsal and ventral rami. For sympathetic nervous system, they will either, as we said, synapse in the sympathetic ganglia and then go out, or they'll pass right out and go into the prevertebral ganglia, right? So these are the paravertebral ganglia. So they may synapse there and go out, or they go into the prevertebral ganglia and pass out. These are outside the central nervous system. They have motor neurons, but since they are outside the central nervous system, the neural crest cells, they develop from the neural crest. So you can see here as a review, the neural crest gives rise to sensory neurons, right? Because they are present here. Which sensory neurons? Both somatic and visceral. And the neural crest gives rise to motor neurons. And which type of motor neurons? It gives rise to the postganglionic, right? Motor neurons. Followed? Okay. Now this is, in your books, is kind of described as a separate nervous system, but it really is kind of related to what we have done so far. The enteric nervous system is often also, it's the visceral part of the nervous system, which is to do with the GI tract. So here we have, remember we talked of those ganglia which were in the walls of the organs. So here we have two kind of sets of ganglia which are present between the smooth muscle of the gut or in the connective tissue. And those ganglia have special names. They are known as submucosal ganglia and plexus, and myenteric ganglia and plexus. So the autonomic fibers which come, the parasympathetic especially, they come in synapse in these, and then the postganglionic fibers pass through. Sympathetic fibers will just pass through the ganglia because they've already synapsed in those prevertebral ganglia. And then if sensations have to pass, they will pass through here and go back the same way, like we said. So this is the entire enteric nervous system. Okay? And this was something I made a reference to. They have different plexuses all over the body. Visceral plexus are all the plexus which you see in relation to the organ. So in relation to the lungs, in relation to the heart, in relation to the various gastrointestinal organs, and then you have or plexus in relation to the genitourinary system. These plexus just means a network. So this plexus contains parasympathetic fibers. It has sympathetic fibers also in it, and those visceral afferent which has to go back. So that's what this visceral plexus contains. Okay? And the somatic plexus, remember I told you that muscles develop from many myotomes. So instead of having many nerves supplying them, the body sort of made a adjustment. So what it did, it got those individual nerves to combine together to form a single nerve. That combination, when it occurs, it forms a plexus. So you have different plexuses up in the neck area, you have plexus in the upper limb area, you have plexus in the sacral and the lumbar areas. So these are all, they all develop from the anterior rami or the ventral rami. Remember in the spinal cord, the spinal nerve divided into dorsal rami and the ventral rami. The ventral rami supplied your most of the body wall, right? The skin, the muscles of your limbs and your lateral aspect of the body wall. So they develop from the anterior rami. And in the thoracic region, from the T2 to T12, there is no plexus needed because this supplies the trunk area. So here no plexus is formed, but up in the cervical area and in the lumbosacral area you have plexus formed. Okay. And lastly, an important concept to remember, which is referred pain. Now this is, imagine every day you get information from your skin which is sent to your central nervous system. So you know, something or the other is touching you, you feel heat, prick somewhere, pain. All this information from the skin of the entire body wall is constantly being sent to the central nervous system, and the brain is processing it all the time. You may not even realize it sometimes, that it's happening all the time. But it's not every day that you have something going wrong with your organs, right? It's not that you have ischemia of your organs every day, you don't have stretch of your organs every day, and neither do you have that much chemical stimulation. So what happens is that here, for example, the visceral afferent fibers, let's say from the appendix, they travel, remember we said they travel with the sympathetic fibers, they get into the spinal cord, they pass into the spinal nerve, they have their cell body in the dorsal root ganglion, get into the dorsal horn, and then they will pass on the information to the brain. So the appendix passes through the T10 segment of the spinal cord. Okay? But the skin on this area close to the umbilicus, or where your navel is, the sensations from the skin also travel, and these were somatic sensory, and this one was the visceral sensory. So somatic sensory information travels also in the T10 segment. So your brain is kind of getting information from skin here, but it's also getting information if there's anything wrong with the appendix. Since the brain is so used to getting information from the skin all the time, what happens is that one day, if there is a problem with your appendix and the information is sent from the appendix to the brain kind of misrepresents that information. It thinks it is coming from the somatic region, and it tells you that, oh, that's where you're feeling pain. So you kind of have a vague, diffuse pain around the umbilicus. Okay? This is almost like, for example, let's say every day your mom calls you at 8 o'clock in the evening. So every day you're constantly used to your mom calling at 8 in the evening. But one day the phone rings, it's not your mom, but when you go to pick up the phone, you automatically think, oh, it's 8 o'clock, it must be my mom. But let's say it's someone else. So you see how you kind of in your head misrepresented, there was a misrepresentation thinking it was your mom. The brain does the same thing. Since it's used to information from the skin all the time, it misrepresents that, and so it refers the pain of the umbilicus to an area of skin which is supplied by the same spinal segment. Okay? So that's why we need to know these dermatomes. And just to go back, if you looked at these dermatomes up here, and so physicians often know the dermatomes associated with some important organs. So you can see here, so T10 and T10, which is up here, relate, the umbilicus sends information to the T10 segment. The phrenic nerve, which is to do with the diaphragm, sends information to the shoulder region, and any structure like the liver, gallbladder, which rubs against the diaphragm, also sends information to the same areas. So sometimes if you have gallbladder problem, the pain is referred to the shoulder tip. Okay? So that's why we want to know about these dermatomes, how they become important, not only for just testing, but if you know that, okay, patient comes to you and complains of pain in the umbilical area, you know, and they have fever, they have vomiting, and they have typical signs of appendicitis, you immediately know that it's not just something wrong with the skin, but it's some problem occurring deeper on. Okay? Okay, so that concludes this. So let's